Welcome to our What I Wish I Known series. Today we're talking with Dr. Alex Key, who is a colorectal surgeon at Mount Sinai, New York City. Topics she'll be talking about today will include EMR efficiency and building a practice and doing all that and making sure you're home for dinner. So we're super excited to hear what you have to say and the lessons you've learned over the years.
Hi, Dr. Shalini. Good morning, or whatever time that might be. We are all still learning as we go along. I've been in practice for now almost 24 years, if you can only imagine, starting in New York City, where you can throw a stone and hit like 10 colorectal surgeon. So it's a little challenging, at least to start a practice here in Manhattan. And I'll be perfectly honest, when I started, there's not a whole lot of patients that comes to me. And you have to find your niche in all of this and give them something that they might want to come for. The first part is building your practice. Don't be afraid to walk the beat. I used to go and sit in all of the referring physician's office. They already have a referral pattern set out for themselves. I will wait in the waiting room, and they enjoyed making me wait a little bit in the waiting room with my business card and kind of meet them, shake hands. And sometimes you only really meet their PA or their medical assistant, but sometimes they're the one who gives out the cards to the patient when they need a colorectal surgeon. So a little extra legwork does not hurt. We all hear about being available, affable, and ability of all of that. Those are important too, but just kind of have to go out and find what you introduce people to you and what you like. Another aspect is kind of within your specialty, find your passion, because if you're passionate about it, you're going to really do a lot with it, and people will know you for that specialty. Like, for example, I love doing robotics, and I also like fecal incontinence, one of those things I'm passionate about. So I have a course in it. And being that is my specialty and I love it so much, also people know you for doing certain procedures and certain specialty. The advice I can give about starting a practice is just that it's a lot of work and just finding where within your community and what you like and how you can build upon that, and not worry about taking the time to go from door to door and knock on doors and sit in waiting areas if you have to introduce yourself so that they can help change their referral pattern and know you as a person.
Did you have help with that, like from administration where you were, or was this something you had to do organically by yourself?
I think this is something I did by myself, and probably one of the best advice I can give is before you sign your contract, put that within your contract that they have to help you build your practice. That could be from advertisements, social media presence, introductions, and have a budget for you so that you don't have to do it all yourself, because it's in their best interest too to build your practice and help you build your practice so that you can be busy from the get-go.
And I think also, to your point, knowing your environment, like New York City, having, trained there as well, you could, just turn around and there's a whole other healthcare system that will have doctors that can help you, not to mention the boroughs, Long Island, you have a lot of choice. Whereas other places where one might get a job, it's more, you're just going to show up and there'll be a whole panel of patients for you to see, if it's a clinic model or something like that. So I think when you are ready to sign your contract, to know those things that you mentioned, like what is going to be required of me to build a practice? Is it something that I have to grind out on my own? Will I have the support? Or is it one of those places where that's not so much the emphasis because of how their model is? So that's great advice.
I think the second thing to talk about is EMR, our ever so favorite, and how to get that done. One of the things I realize now that I did not do is to part of your contract say you need a scribe or someone to help you get those things done. As physicians, we want to see patients and look at them in the eye when we talk to them. At the same time, we are pressured to do a lot of clicking of all of that information into the EMR and also do billing within the EMR. And it gets to be quite time consuming. Also, if you don't get your charts done in time, it's difficult because they'll be on your back about not getting the billing done. And realistically, at the end of the day, after you see the patients, you have to put all that information in for documentation and for billing for the hospital and your institution. I don't have a scribe, but I do have a physician assistant where I finally got negotiated with, since fortunately I have a pretty robust practice and I see a lot of patients. So also having those smart phrases. Take the time, invest the time in making your own smart phrases, because it will save you a lot of time in the future. So then you can do just clicking instead of just typing out the whole conversation. I know some people use a voice recording that Dragon or some other program that helps dictate their office work. But I find for myself personally, having the smart phrases made out, and then my medical assistant, actually, every patient that I go in to see, they come in with a master list. They also write down on the side what was seen, what was done in shorthand form. For example, if I rubber band ligated a hemorrhoid, they put RB next to it and which side. So later when I go back to do my charts, so when they help me to put the skeleton in the framework of the charting, it's accurate, because at the end of the day, you want to be as accurate as possible and not lose out on that part. Also getting it done in a timely fashion with help, because if I have to do that every single time, it will take a lot more effort on